We will begin today with rationale and considerations for training special populations. This presentation should take about 30 minutes. You are able to stop each slide and listen to it individually if you choose to do so. So, rationale and consideration. Participation in structure exercise training is known to provide significant physical and psychological benefits. Exercise conditioning is not considered a viable means to enhance functional capacity and independence across different populations. Unfortunately, as you know, many persons who could benefit the most, or those who could benefit the most from increased daily activity, happen to not do so for various reasons. Various populations, due to their inherent characteristics, require specific exercise equipment and facility access compared to the general population. Ideally, we do, when possible, integrate them into the regular population or general population, which is a better term. Because of their particular needs of these individuals, they may also require specific exercise programming or special considerations for exercise. And therefore, specially prepared exercise professionals, as yourself someday will be, these individuals are going to require specialized supervision. These are the groups that are considered special populations with regards to their particular requirements for safe and effective exercise training. So as we go through this course, this is what you want to consider. Special populations include groups that differ from the overall population with regard to age. Later on we'll talk about youth and older adults, or specific conditions related to their gender, as we deal with female athlete triad, which one of the groups we'll cover, and pregnancy. So the objectives for today is to discuss the benefits of an active lifestyle, which I'm sure you all are very well aware of, but we want to make sure that we're on the same page. Explain and discuss the negative consequences of being sedentary, and not only sedentary, but spending a lot of time on sedentary behavior, such as screen time. List some of the reasons our individuals commonly cite for being sedentary and not being active, or maybe the excuses, and discuss which of these could be addressed by us as exercise professionals. We'll also discuss some of the characteristics of special populations, what we use to define them as special populations when it comes to exercise training and exercise assessment and exercise prescription. Because we're dealing with special populations, we also have to be aware of the Americans with Disabilities Act. So if you have a facility larger than 15 employees, you will have to make sure your facility is ADA compatible with regard to exercise. So we'll discuss those guidelines. Also, as you will hear me and have heard me if you were in other classes with me, make sure we're aware of what the scope of practice is for us as exercise professionals that does not infringe into what a physical therapist or a medical doctor or a dietitian would have to do with special populations. And overall, we'll discuss the concept of what I said earlier, of whenever possible trying to be inclusive in fitness, where we have individuals with maybe disabilities or with that are part of a special population participating in the environments with the general population whenever possible. So as much as we can, if we can include them and not have to send them to more expensive locations such as cardiac rehab locations, that would be the priority. Special populations are a little bit more, despite the physical and psychological benefits of exercise, participation is not always a given for all people. In particular, when there's more disabilities, when there's more physical limitations, when there may be some pain involved, that's an extra barrier that those individuals have to overcome in order to become more physically active, and not only that, but maintain a physically active lifestyle. So all those are important considerations that we have to make. So given the fact that they may have different biomechanical differences, physiological differences, some signs and symptoms of the disease that may interfere with an active lifestyle, we may have to take the exercise guidelines and alter those guidelines to better fit the needs of those individuals. So understanding their differences, understanding what their limitations may be, is the first step before we can begin to design exercise programs that could be successful with that individual. But as far as the definition of what a special population is any individual that has maybe a chronic disease or a disability, or any other group that may be different based on age. So when we look at youth, and then later on we look at elderly, and then certainly differences when it comes to gender, such as pregnancy as well. So this semester we'll try to cover most the ones you're more likely to come in contact with. But as I told you the first class, the goal here is to help you figure out what to do when you're working with a individual that may have a condition or illness or limitation that you are not familiar with. So how to prepare yourself to make sure that exercise for that client, that individual, maintains safety and effectiveness. So who is considered a part of a special populations? So let's look first at the population of the U.S. From 1990 and what's predicted by the Census Bureau to happen in 2100. So think about that. If you look at the population, let's think about age. What baby boomers now are becoming older. Many of them have started to retire already. So what's going to happen? We have better medical care and medical treatment. We know more about how to keep people alive longer. So when we look at the 1990s, some of you might have been born in the 1990s, I think. When you look at the population, you see the majority, you see that, if I move my mouse, you see that the most folks were in this mid-range right here, in the 25 to 44 age range. When we look at the population in 2100, you see that it's a lot more folks in the range relating to be past retirement. We saw here in 1990, 95 to 90, we see that we're going to have a lot more individuals making it to 100, and certainly a lot more individuals living to be older than 100. So we're going to have an aging population, an older population, and with that then we can predict that we will see a lot more individuals that may fall into the category of the special population. We're needing special considerations for exercise. Leading causes of death in the U.S. This is life expectancy at birth was 79.9 years, but the leading cause of deaths in the U.S. still heart disease, number one killer of men and women. So sometimes folks think that breast cancer is the number one killer of women, but it actually is heart disease. The second leading cause is cancer. Think about what may be the number one contributor to both of these two. So if I were to ask you, what is the number one risk factor of getting heart disease, the number one thing you could quit today to reduce your risk of heart disease and cancer, what would you say? If you were thinking smoking, that is the correct answer. Some folks think, oh, it's obesity. Obesity and sedentary lifestyle are actually number two risk factor for heart disease. But it's really, smoking is still up there. So if you have one thing that you need to quit or change about your lifestyle, smoking would be the first priority. And if you look at cancer, then I would ask you which type of cancer is the number one. If you were thinking lung cancer, you would be correct. And again, folks sometimes think it's breast cancer. It's actually lung cancer for the same reason. And same factors that lead to stroke, same risk factors that lead to stroke are the same as they are for heart disease. So a lot can be done by, one, if you're a smoker, stop smoking. If you don't smoke, then never start. And number two, being physically active and maintaining healthy body weight. With that, you can look at all these lists up in the top part here, including chronic lower respiratory diseases, which again, what do you think is the leading cause of that? That would be also smoking, COPD, which it's emphysema and chronic bronchitis, also related to smoking. Some association over here with diabetes too, sedentary lifestyle and smoking also related to diabetes. We'll look at all that. And there is some evidence that it could also be affecting Alzheimer's. So some lifestyle changes could really have an impact in what we see in the number of deaths per year related to lifestyle habits. So key chronic diseases, here are the facts, and again, I can't emphasize enough, if you're looking for changes in your lifestyle, that would be the first thing to change. But yes, heart disease and stroke are most significant. They're very closely related. So heart disease is related to coronary arteries being with plaque buildup and being hardened. When eventually they're completely blocked, that could lead to a heart attack, and could lead to all sorts of other issues with the heart, with the valves, and the stroke. Then it's when the blood supply to the brain is affected, that could lead to a stroke. So, and all related to atherosclerosis that eventually leads to arteriosclerosis, and we will discuss that further when we get to cardiovascular disease. So making some lifestyle changes now would lead to lots of changes in your outcomes as you become an older adult. As we saw, cancer being the second leading cause of death, chronic lower respiratory disease, again that's COPD, and COPD, which is bronchitis and emphysema, and then diabetes, again, so associated with, in some cases you have type 1 diabetes that you're born with, but type 2 diabetes is the one most people may have, and it's related to lifestyle, and it happens later on in life. So we'll discuss that one a bit more. But diabetes is also the number one cause of extremity amputations. So a lot can be done, again, as I keep reiterating, by lifestyle changes, and that's our goal, maybe our priority as exercise professionals, to motivate people to make some significant life changes that may not only improve their current life, but throughout their lifetime decrease the risk for disability and improve the quality of life. And that's what it's about. Certainly we're all gonna not be here forever, but we want the time that we're here to be a time that has quality, and that we can do the things that we want to do in life without pain and without disability. Some other facts here. Okay, arthritis, and we'll discuss arthritis a bit when we talk about older adults. The most common cause of disability, people are, if you were to ask this in a questionnaire, people wouldn't really notice that, but it is a vicious cycle. So you have pain in your knees, and so because you have pain on your knees, you decrease your activity. Because you decrease your activity, your arthritis gets worse. And so the more disabled and the more sedentary you are, the worse your risk for getting other kinds of diseases. So it becomes a vicious cycle. And certainly obesity has become a major health concern. Again, especially obesity connected with sedentary lifestyle. The question is always what comes first, the obesity and then the sedentary lifestyle, or people are sedentary and then they become obese. Well, it's different for each individual, but it does tend to run together. Hopefully you remember the numbers about this. The good news about this is that this has remained constant for a few years now, that 1/3 of Americans are obese, but the majority of Americans are either overweight or obese, meaning that they're not at a healthy body weight. They need to decrease their body fatness. And so again, that's, if you're going to be working in the exercise physiology field, you're going to be working with general populations, that may be the driving reason that they come to see you for weight management. And so important to consider, and not only in adults, but unfortunately in the young population. This is a number that has increased dramatically over the years. 1 in every 5 young people aged 16 to 19 are now obese. And so that's something that we did not used to see, and we do see now. Other chronic diseases, facts: 7 in 10 deaths each year in the United States are due to diseases. And the thing about this is that we don't have to die from a disease. We could die just from old age, right? And some see that as a disease. And the problem with disease is that, again, leads to pain and disability and discomfort and really impacts the quality of your life. And we do know that exercise tends to improve those outcomes. About 133 million Americans, or 1 in 2 adults, live with at least one chronic illness. So that's really disturbing to hear, right? And then think about the healthcare costs. We're all paying more for healthcare, in part because of all these facts. More and more people have to access the healthcare system. If we can see ourselves in the exercise science world as being preventive care, and more insurance companies now are seeing that if they were to pay for preventive care or wellness care, the cost of healthcare will be less, because if someone waits until they're sick to go to seek healthcare, the costs are higher. If someone waits to seek healthcare when there's an emergency, the costs are even higher. And again, approximately 1/4 of persons living with a chronic illness experience significant limitations in daily activity. So if they didn't have an excuse before for being sedentary, once they have an illness or disease, now it makes it even more of a hurdle to make physical activity part of their regular habits. So, and the percentage of U.S. children and adolescents with chronic health conditions has also increased. We see more and more children with high blood pressure and type 2 diabetes than we used to, and with the beginning stages of heart disease, which is very sad. And this hopefully is going to stabilize in the future. So here's the good news. I know it's sort of depressing to go through the facts. So what is the good news? The good news is that we have the answer as exercise professionals. We are the magic pill. We are, I love the ACSM with their motto, exercise is medicine. And it is. Exercise it decreases the signs and symptoms, so it delays worsening of the conditions. So exercise is the answer for a happy life. So the good news for those with chronic conditions is that they do not have to avoid exercise. For some folks, perhaps for a bit, they may have to decrease the intensity and the amount, but eventually the goal is to have everyone involved in some type of physical activity, depending on where they're starting out. So what they do require, though, is specialized modifications, guidance and instruction when participating in physical activity. So this is what we're hoping to gain from this course, that you learn how to modify the exercises depending on the individual's conditions and limitations. And so that's what we want to be able to do. Take the exercise guidelines and make them safe and effective for that individual. And regardless of what condition they have, we do know all of these benefits of exercise, that if you are physically active and you exercise regularly, you are going to decrease your risk for high blood pressure and heart disease. You're going to reduce your risk of getting type 2 diabetes, which type 2 diabetes is the one you get later on in life. Reduce your risk of osteoporosis, which could be a very limiting condition. First, keeping your muscle mass and your range of motion, and also maintaining. It'll be easier for you to maintain a healthy weight and to maintain a healthy amount of body fat. So exercise for special populations, the name of this course, right? We do still need to get input from medical personnel, or know when to get input from medical personnel and other qualified healthcare providers to make sure we minimize risk and optimize the benefits. So we need to know, though, who may be required to seek extra medical assistance before continuing on with an exercise program. So that's one of the things we'll be discussing in the next couple of lectures. We'll be talking about how to determine who needs further clearance before participating in our programs. But the good news, again, is people with special conditions are now encouraged to exercise, really, even after open heart surgery. Very soon after that, individuals are moved around and asked to be active. So, but you still need to know, you need to be prepared to and understand how to keep exercise safe and effective. So here's what I was hinting at earlier. This came from ACSM. Exercise is medicine. So when we look at exercise for the treatment of disease, it's not a cure. Exercise will not cure a condition. Exercise has more of a palliative approach, meaning that it makes the symptoms less disturbing in your life. So treatment of disease has usually focused on how you can cure it, and that's maybe what and how some may see medications, but exercise actually may sometimes delay the onset of conditions and may actually maintain ability and quality of life for a longer amount of time for individuals. And so that's how we want to see it. So the goal of exercise as medicine is that primary care providers, physicians, as part of their script, will not only prescribe certain numbers of treatments or pills or medications, but that they may also prescribe, like they write it on a script in a pad, working with an exercise physiologist, that they actually prescribe exercise. So that is the goal of the exercise is medicine slogan, so that doctors are more prone to do that. So maybe we do that with physical therapy, right? So you get a script for physical therapy, and so more and more doctors, the goal of exercise is medicine, more and more doctors will actually prescribe medicine. If you click on this link, it's dukefitness.org, and they actually explain what are the movement of exercise as medicine is geared towards doing, and it's that to get doctors to see exercise as part of the treatment plan. So I don't have to tell you, this is why you're in this major, but in case you need a reminder when you are working to motivate people to become more physically active, these are facts that we know about exercise. It has a disease-reducing benefits. So things like if you reduce body weight, just reduction of body weight of 10 to 15% will decrease your blood pressure. So think about that, how much cheaper that is than medications. Improve your lipid profile, I mean your cholesterol, improve your resting blood sugar level, so help you with your diabetes, or if you don't have it, it will keep you from getting it. And it improves the body function of every system in the body. As we know, if you studied exercise physiology, all of the training adaptations that we get in every system of the body based on exercise. So, and it persists across ages and genders and training status. Yes, older people can get stronger, older people can see improvements. There's some studies that have looked at centenarians, individuals that are 100 years old, maybe wheelchair bound, and with resistance training have gotten stronger, been able to lift their head up a little bit higher. So you're never too old to reap the benefits of exercise. So inactivity causes, so I have a screen there, about only 15 to 20% of adults about 18 exercise regularly. So most folks are not very active. And because of this, results in a greater incidence of chronic diseases, increasing costs associated with healthcare. Again, if you remember back to the charts I showed you earlier on in the PowerPoint, smoking is the #1 cause of heart disease and cancer, and perhaps even diabetes, but obesity and sedentary lifestyle are the number two risk factors. So society, well, certainly our society have tremendous advances in technology since the day that I was a kid, and so our careers have become less dependent on physical exertion. So you can do a lot more work with machines that we used to, and many folks don't even have to drive to work. So that was some kind of an activity. You had to get dressed, and you had to get in your car, and you have to drive to work, and you have to get out of your car. So many folks now just get right out of their bed in front of their screen and can work from home. So even then, we're also seeing an increase, as you saw earlier in the charts, of individuals over 65, and this is going to continue to happen. More and more individuals over the age of 65. So when you're working out in the field, you're going to have a greater number of your clients and patients and participants that are going to be older adults over 65. And certainly in schools, we have seen the reduction in recess, the reduction of PE every day. When I was a kid, we had PE every single day for an hour. And so that has actually shifted. And so when you make those changes in children's lives, when you at an early age begin to limit activity, then that becomes something that carries on throughout their adulthood. And we'll discuss that more fully when we discuss youth and adolescence towards the end of the semester. All right, and there's many individual causes of inactivity. Then that first one, perceived lack of time or convenience, that's going to be the number one reason. I just don't have time. I'm just too busy. And so that's going to be one that you're going to have to know the answer for. How they do have time, how it doesn't take as much time as they think, and how even a little bit, 5-10 minutes of doing some activity, some push-ups, some standing in place squats, body weight squats, would be good enough to add to start with. Lack of motivation or interest. If you remember from fitness and weight management, if you took that class with me yet already, you know that it all starts with goal setting and success, right? So we have to help them set some goals so that they can have success, and having a goal that motivates you. Having goals is what motivates you. So that's the first step, setting smart goals. Some people just don't have enough personal management skills or support systems, and so that's what you can be. You can help them see that it's not that they are not successful, is that they have not been doing it quite right in the past. And perceived lack of suitable resources. They just don't think they know how to do it right. Because probably they've tried it in the past and have not succeeded. And the other reason is that maybe they do have a disability, or they have a chronic disease, and they're afraid of making things worse. And so they need your expertise and advice in order to become more active now. So in this course, we hope to address, to give you some specialized knowledge and how to deal with special populations. And again, I don't want you to, the goal is not for you to memorize all these things, because you can always refer back to it. Is the process of how to prepare yourself to work with an individual with unique attributes that you maybe have never worked with before. So how to understand first, what is it? Then what are the physiological differences, maybe biomechanical differences? What are the current exercise guidelines, and how do I modify them to make sure that it's not causing doing anything that's going to make things worse? Maybe there's specific exercises that may be best, and again, we're always relying on the scientific evidence in order to make those determinations. Looking at anything that has been documented as a contraindication, this is a big word, means that not indicated. So we're going to look many times at what may not be indicated. For example, if you have high blood pressure, it's contraindicated that you do the Valsalva maneuver, where you do breath holding, because that will raise your blood pressure unnecessarily. So we'll have to know that. If you are pregnant in the early stages, it is not recommended that you do skydiving, for example. So those kinds of things we're going to have to be aware of, and have it on our list of things that we follow with those individuals. As far as scope of practice, and just to remind you again, this is so important, we are not licensed yet, not yet. My goal before I retire is that exercise physiology will be a licensed field, just like athletic training and physical therapy. But we're not there yet, so we are bound by our certifications, and basically what's in your certification textbook. So if you're an exercise physiologist, for you would be the ACSM exercise physiologist textbook. That is your scope of practice. Anything that is in there and you follow it as is stated, then you're covered. But overall, it includes, for us, you can do health appraisals, physical assessments or fitness assessments, designing exercise programs, and supervising exercise training. You could also do exercise, nutrition education. What you cannot do is nutrition counseling, where you're talking about diets and menus, and you're actually prescribing supplements. That is a dietitian's scope of practice. Okay. Certainly, we don't do anything that sounds like something a physician may do. So no diagnosis of any kind of condition. No soft tissue mobilization. That's a physical therapist. Gait training, especially with disabilities. neuromuscular education, all of that is physical therapy, or any counseling for disorder eating or body image. They need to go to a psychiatrist or psychologist or even a clinical dietitian. So what is the Certified Special Population Specialist certification? This will give you an extra added time that you have spent studying how to work with individuals with special populations, using an individual approach to assess, motivate, educate, and train special population clients. So this certification is by the National Strength and Conditioning Association. If you click on the link here, it'll take you to their website. You can, so the goal, if you want to work with special populations, the first priority would be to get either personal training or for you with a degree, I would suggest the exercise physiologist certification, and then get specialized certs such as this one to show that you have extra time and extra effort spent. In our textbook, it is a textbook for the NSCA CSPSS. So you already have it. So maybe get those two certifications by the time you graduate. So another question is, do they have to work in a clinical environment? They do not. Some folks may have to if they have other factors that they may need immediate care, so that where if you're in a hospital environment, that you can call the code and get a lot faster access to cardiac life support. But most folks with other disabilities can work in your regular health club environment. So whenever possible, having inclusive fitness approach is what we're going to go work for. So they are exercising and participating with the regular population. Very, very similar to what you've seen in schools, where you have, I'm sure you remember having classmates that had various disabilities and they were in the classrooms with you. So this is the same when it comes to exercise. But for some of those, especially for if you're working in a large facility, your Law Fitness, your YMCA's, the facilities have to be built to comply with the Americans with Disability Acts. You can't discriminate or keep individuals out because of a certain age. So you can't say, oh, this is only for people that are 50 and under. You have to have a very inclusive accommodations to fit everyone, and you have to follow ADA guidelines. So since 1990, unless you have a facility that's small with less than 15 employees, so if you have a personal training gym, maybe the guidelines are not going to apply to you. But if you have a larger facility, you do have to have accessible facilities that comply with all of the guidelines. Things like usable doorways and levers or automated doors. So if you're going up with a wheelchair, the doors automatically open, or you have some kind of switch that can open the doors. Pathways, think about someone with a wheelchair. They have to be able to get around. So a lot of these things you have to think about, can you get around in a wheelchair if it's too small? So at least 3 feet in between all exercise stations. Make sure you have open floor space, and you have some kind of options for someone. So let's say that they cannot use the bikes or the treadmills. Maybe you have an arm ergometer that they can use instead. So all that is going to be important. Here's an example of a sample ADA layout for a small facility of what kinds of equipment you may want to have. And other recommendations to increase access, if you have more folks that have special needs, you're going to need a little bit more staffing because you're going to need more assistance getting in and out of equipment. Make sure that you have mechanisms that can assist them with holding, straps, stabilizing straps to limit torso control for those that need it. If you have lots of children, you may need, or obese, you may have different sizes of the equipment. Realize that the average equipment is made for your 150-pound, 5'8" male, so it's not going to fit everyone. So you have children, you're going to need different kinds of equipment. And for some folks if you have a lot of older adults even, you're going to have some area in the work floor where they can sit for recovery. And think about if you have limited equipment, if they're sitting for recovery in your equipment, that's going to limit movement. So maybe having some space where they can go and sit if they need longer time in between recovery. And if you have lots of children with cognitive issues, maybe Down syndrome or autism, you may need to consider the visual distractions and other things, lighting and music and other things that are going on in the environment. And so some of you guys are covering Down syndrome and autism, so you'll tell us more about that. So in conclusion, the benefits of exercise for all populations is widely known, and that again, everyone can benefit with some form of exercise. So some folks may have to limit activity for a little while, but always encouraged to go ahead and keep moving. So special populations again include those with specific conditions requiring training adaptations from the general population. So it's still the next lecture or presentation, we're going to talk about what the exercise guidelines are so that you fully understand them, and then you know what modifications you're making given certain populations' limitations or needs. Okay, this concludes my lecture for today. If you have any questions on the lecture, please post them to general questions, course questions, and I'll be happy to answer and reply to those. Thank you. Until next time.